Just say, okay.
Okay.
Hello, everyone. This is Dr. Michael Kachmar. Welcome to Scrubbing Up with Dr. Michael Kachmar. Today's date is, and Jeremy, you want to just check, make sure we're live streaming up on top. Today's date is January 25th, the year of our Lord, 2025. And Jeremy, all you got to do is just go up here and just check the thing if it's streaming. Yeah, we have a little technical difficulty today, like a lot of times we do. Just take the mouse here and just put it up there, right there, yeah. And see what we're liking. Just go up and down on that, see what we're streaming to. So it looks like we're streaming to everything.
We're streaming on everything, yeah.
Anyway, thank you for tuning in today. My name is Dr. Michael Kachmar. I'm a board-certified reconstructive foot and ankle surgeon. I've been in practice for over 35 years. Jeremy here is our assistant. Yeah. Jeremy, you want to say hello?
Hey,
say hello.
Everybody. You know me. I'm your old pal, Jeremy, aren't I? Yeah.
Yep. So, Jeremy, we're live right now. Can you give them the phone number if anybody wants to call us up and talk to us if they have any information?
Oh, sure, yeah.
Right.
If you want to call and join our show today and talk to the amazing Dr. Michael Kachmar, call us at 732-237-4949. That's 732-237-4949.
All right. So, anyway, Jeremy, again, this is a medical, political, medical. We talk about everything. Today, we're going to talk about mixed bag. We're going to go pretty much into medicine. I have an appointment today, so we're going to try to move along quickly. So, we're going to talk about the first thing we want to talk about is a black box warning for a drug. And what that means is the drug company comes out and says, you know, there might be some issues. This is a very common antibiotic. You want to throw the go to my my iPad on there.
Yeah.
So this is an antibiotic. This is a post. So it says here, and the people who are on Spotify or podcast, you might want to go to the video. We're on YouTube and Rumble and everything. So antibiotic given to many New Yorkers linked to fatal reaction. This was an article. A popular antibiotic given to millions each year have been linked to dangerous and sometimes fatal reactions. Bactrim. So Bactrim is a medication that's real common out there. That's the trade name. And it's given to, they say, at least 3 million people. I've given this drug tons, and it's given to a lot of kids. And it's used for infections, urinary tract, foot and ankle, middle ear infections, traveler's diarrhea, a whole bunch of stuff. And they're looking into, what the researchers are now looking into, the patients had severe, rare reactions that landed a number of young children on life support. This is CNN report. And you guys could go look into this. So the FDA recently added a warning to the drug's label stating severe pulmonary adverse reactions can occur within days to weeks of taking Bactrim. That's Bactrim. That's the trade name. I'm not going to get into the medical name. It's complicated. Just you could look it up. I recommend everybody look this up. So here it continues on in the article. This can result in prolonged respiratory failure, leading to patients needing a ventilator. Lung transplantation or death have been reported in patients and otherwise healthy individuals, the FDA warns. They don't know what's going on, unclear what is happening here. So let's not panic, okay?
Right.
Let's not panic. Researchers are now trying to determine why Bactrim can cause this rare and sometimes fatal reaction. An investigator identified a genetic marker many patients tested have in common. So researchers are now looking for more cases. It's rare, but I just want to give you guys a heads up on that. You might want to go to the CNN report. So the drug, again, is Bactrim. You could go back to me, Jeremy.
Sure thing.
It's a very common given drug out there. Oh, shit, I just hit the thing. Yeah. There it goes. I'm good. And sorry about that. And it's a good drug. We use it a lot. And I don't know what to tell you. I would talk to the pediatrician. For me, I'd be very careful giving it to a child because it seems like it's the young kids. So I would give them cephalexin or doxycycline. Right now the drug that a lot of ERs are giving is doxycycline. I have to be careful with doxycycline on children, though. It could yellow their teeth, and it can make you very sun sensitive. There's other medications, penicillins. You got your augmentins, amoxicillin. There's all different kind of drugs, cephalosporins. But this is it's called Bactrim. So I want everybody to be careful about that, Jeremy. It's just throwing it out there.
Yeah.
Okay. Now the next thing is you just had a show with Dr. Jasper, right?
Yeah.
Who's an anesthesiologist. So this is an interesting article here, and I just throw it up because, you got to be careful. Everybody thinks, listen, if when you have anesthesia, you want to have it done in the right place by the right people.
Right.
Now, if you remember, there was a famous comedian, and she died. She was having a colonoscopy done, and at the same time, she wanted to have something done with her throat, and they did a procedure on her, and her vocal cords closed up, and she died. And there was no anesthesiologist there, and which could so this was a GI doctor who was giving her sedation. And you really need to have, if you're going to go.
Yeah, if you have like asthma and such.
Oh yes.
If you suffer from asthma and you're given the wrong medication,
right.
it will close up your. Yeah.
Right. So it's Joan Rivers. Go look at.
Was it Joan Rivers?
Yes.
Okay.
Go look at what happened to her. Okay. It was a lawsuit. It's all written out. I'm not going to make any allegations, but my point is that I don't think there was a board certified anesthesiologist with all the equipment he needed.
No. That happened to a friend of ours, a mutual friend of ours, recently, and it blew my friggin' mind. But accidents will still happen.
And so he had surgery. We were not going to say who it is. We had surgery at a bona fide surgery center.
Yeah.
But the anesthesiologist, I think, might have been a little bit preoccupied.
Maybe scatterbrained.
Who knows? But he wound up in a hospital for 2 days. So here's a good one here. Not a good one.
But when it happened, he was struggling to breathe.
Yeah, he had asthma. Now you got to be careful. So you can't go do shortcuts. Okay, so let's the next one here. Let's go to my iPad, Jeremy. So this is another interesting case here with regard to anesthesia. So this is an influencer, Ricardo Godoi, dies after being given general anesthesia for a huge back tattoo, leaving fans in shock. So he was going to have a tattoo put on his back. And what I understand the article to say is that he had the anesthesia people come to the tattoo place. They supposedly brought the equipment, and when they put him under, he died. Now, again, I don't know. That's another thing, too. If you're going to have surgery done, you need to be cleared, especially, my opinion, by a cardiologist for your heart.
Sure.
Make sure you got to have a strong heart. If you don't have a strong heart, man, it could go. So let's leave what happened here. So this is in the Newsweek. So this was the U.S. Sun. An influencer has died on the operating table after being given general anesthesia for a huge back tattoo. So general anesthesia means they put you out completely out, and they put a tube down your throat. Okay, that's general anesthesia.
Yeah.
Okay, you're not breathing on your own a lot. They have to breathe for you. Okay, so this guy, he's 45 years old, went into cardiac arrest at a private hospital during the tattoo session, with doctors unable to revive him. Let me just go here. So that's what the article says there. It says Brazilian influencer employed a tattoo studio who said they hired a private hospital with all the equipment, staff, and drugs necessary to help give him the massive inking. He told his 218,000 Instagram followers in a message shortly before the tragedy, I'm about to undergo a surgical procedure and will only be back here after 4 p.m. Police investigation was ongoing today as officials looking into the tragedy. He died on Monday in the coastal town in Brazil, southern Catina state. The owner of the tattoo studio, which was going to ink, Ricardo said, what happened was that at the beginning of the sedation and intubation, he went into cardiac arrest. This occurred before we even started tattooing him. Well, of course, they're going to say that. Oh, yeah.
They want some kind of business after this. I don't think they're going to have it, but yeah.
So he was quickly checked, and a cardiologist was called in to try to relieve him, unfortunately without success. A message posted on his Instagram yesterday said, "It's with great regret that we inform you about the death of Ricardo." And at this, so I'm going here, memory, another tribute. I'm just going here. He had a sad case here. He was going to have a full back tattoo done with us under general anesthesia, sedation, and intubation. Now, I don't know, let me see. To do this, we hired a private hospital with all the staff, equipment, and anesthesia drugs necessary for safety of the procedure.
Yeah, that staffed up part. He actually paid them.
Right. We also hired a doctor with a specialization, anesthesiologist and experience in intubation, whose documentation was approved by the hospital. Blood tests were required beforehand, which showed no explicit risk in carrying out the procedure. He signed a consent. Hospital where he died has been named locally as, I can't even pronounce it. Speaking ahead of funeral. Okay, so get back to me, Jeremy. I just want to point out, when I bring this up, the reason why I bring this up is this. If you're going to have general anesthesia, a procedure, okay, here's where the problem I see here. Like, I'm a doctor, okay? I'm going to operate on you. I know how to assess your risk for surgery. Okay, now, most doctors do. Do they always do it? Sometimes they defer it to another doctor, like a cardiologist or primary medicine, and that's dangerous. I make sure I ask all the questions. Hey, when's the last time you had a cardiac stress test?
Yeah.
Are you diabetic? Have you had any surgeries before? Do you have any allergies?
Information.
Is anybody in your family had a blood clot in the past? Because that you could be susceptible to that. Yeah. Have you had any issues with anesthesia before? Have any chest pain? Indigestion? Blah, blah, blah. As somebody at that age, I would get a chest x-ray, I would do blood work, and I would have them cleared by a cardiologist. Now, the tattoo people, right?
Yeah.
That's nice that they hired an anesthesiologist, but did they send the guy for medical clearance? They're tattoo people. They're not going to do that. So in other words, if I'm going to operate on you, Jeremy, I would not bring you to the operating room until you're cleared by a cardiologist.
I don't understand why.
You understand?
Yeah, but I don't understand why he needed to be put under for a back type.
So big. It's a massive.
No, I get it.
Probably the pain.
That's why people do these in, like for me, if I'm getting a big tattoo done on my arm or whatever, I go a couple of times. He'll do like the outline maybe and a color in this, and let it heal, and then continue. Right. But this guy, what he wanted to do was it all at once and now, and then you're going to probably need that. But I've gone through like really large tattoos where I'm sitting here now wondering why anesthesia was even needed.
Well, here's the thing. That's one part of it, and I agree with that.
Yeah. But I do understand, because we have patients at my place who need anesthesia for an epidural shot. I do not myself.
Right.
But a lot of people do, because their pain sensitivity is different.
But here's the thing: the anesthesiologist, that's his center, that's his surgery center.
Yeah.
And he is very well very well trained to assess the risk.
Yeah.
So he's going to ask the questions, and the staff does too. And like for me, I just want to get back at it. If you're going to go into general anesthesia, I don't care if you're going to get a tattoo or a friggin' mole taken off your nose.
Sure.
If you're going to go into general anesthesia, they're breathing for you. They're intubating you. They're putting your body at stress. They're giving you drugs that are very, very powerful. You have to have a strong heart. Now, there's other things that go on there. Do you have asthma? Do you and you're on blood pressure medicine? Like if you're on blood pressure medicine, we insist that you take that blood pressure medicine in the morning before surgery, because if not, you get a rebound hypertension. So all of these things. And if I have somebody who's at risk, we'll actually keep them overnight. If there's an issue.
Yeah.
So my point is that I think here, the problem with this case was that it was tattoo people who were running the show. They hired the hospital, but did anybody do? They did some blood work, but did anybody really
question?
Yeah,
and exam.
Right. Was there a primary? And was he sent to a cardiologist before? They get the cardiologist after he's dying.
Do you have asthma?
Do you have
diabetes?
The first question I would ask is, he may be a smoker, smoking a lot of pot. Pot's really bad for your heart. He may have been an asthmatic, like you said. He may have had hypertension. Again, it goes on and on and on. So, anybody out there, I just want to throw it out there. If you're going to have surgery, don't be scared, but make sure you get cleared.
Tell everything to them because, I mean, you don't want to hold anything back.
Get a the biggest thing to me, get a cardiac clearance. Go to a cardiologist. Let them do a stress test on you if you haven't had one. Let them do a 12 lead EKG. They'll ask the questions. They'll poke around. They'll listen to your lungs.
I just got it myself.
Yeah.
I just got all that. I had the stress test, everything. My heart's great, thank God. But yeah, you gotta do that.
All right. Let's move on to the next thing. So the next one here, you could give me go to the video, as we say. This is a very interesting thing. I've been talking about this for years. So, do you have your dog? Some people let the dog lick their face.
Yeah, we were talking before the show, and I told him, like, my dog he'll give me a little kiss on the nose, but sometimes he misses and hits my eye, and then it feels like I got like a sty in my eye for the next 2 days.
Sty. Yeah. So here, this is an article. Again, I want to put this in preference. In perspective, I should say. Yeah. It's very rare, but if this is what happens. There's the bacteria that you get. So it's campanocytophagia. How an innocent dog lick can trigger a fatal infection. I just want to go here. Affected populations. So this organism is an extremely rare condition, okay? 2 large epidemiological studies conducted in Scandinavian countries suggested that it may affect between 0.5 and 0.7 people out of every million each year. In the United States, the disease is not nationally noticeable, which means it's not ticked at the national level, so there are no annual estimates of the incident. As of 2018, this is approximately 500 cases of this were reported in medical literature. So I think the reason I just bring this up is this. This is where, so just listen to me, it's people with weakened immune systems are at high risk of catching this organism and developing serious injuries. Other factors are not having a spleen, alcohol use, smoking, and being age over 40. So this is this infection can be caused by 9 species of bacteria that belong to the same genus, and these are found in they live in natural human mouth and tend to cause infection mostly in people who have weak immune system. However, this infection in humans is caused by a specific organism that lives in the mouths of dogs. So this is
now that we actually brought this topic up, I remember something now with my father-in-law's neighbor in Leisure Village,
right?
And she was one of those ladies that all the retired guys were chasing after, and all of that. She bought herself a little puppy, and pride and joy, and all, but. It was from his licking or something, and she went mental. All right, and then they had to put her in a home, like a care home, and then she died. Well, she died all because of that little dog.
Well, so listen here. Patients who become infected with the C. Canemoreus usually get it through the bite of a dog or cat, or if the dog or cat's saliva enters an open wound or sore on the person's body.
Right.
Some people have, like ulcers on their legs, and the dog licks the legs. However, most dog or cat bites do not cause this infection. In the United States, for instance, about 4.5 million people are bitten by dogs every year, but only 20% of them require medical attention for resulting injuries or infections. So symptoms. People who have developed this infection begin 3 to 5 days after dog or cat bite or scratch. Patients may develop blisters at the wound as well as redness, swelling, and pain. They may also experience fever, diarrhea, vomiting, and headache. So the bottom line here is that if you got an open wound or you had surgery, don't let the dog touch you. If you have conditions, have no spleen, immunocompromised, be very careful. Okay, you could go back to me, Jeremy.
Sure thing.
So that's that. So I just want to throw that out. I think that a lot of people do that. They let the dogs kiss them and everything, but just a word to the wise: be careful. Right. If you definitely have an open wound, you cut yourself. If you are get a scratch on your leg, I see this with spider bites or scratch bites, and it's a good idea to soak in Epsom salts and water. Get some bacitracin ointment. Treat it, soap and water, wash it, put some antibiotic ointment on it. watch it. If it doesn't come around, go to the doctor, get an antibiotic.
See, but a lot of people with their animals, they, it's like they're babies, but you got to realize they're not actually human at the end of the day.
Right.
And there was an old saying that is very incorrect, that a dog's mouth is very clean. It's not. Okay? It's not at all.
No, but I think, and especially after they eat another dog's crap. But here's the point I'm making. I mean, just if you're immunocompromised, mostly, I don't want to scare people because, it's a lot of people get their dogs, lick them, everything. Yeah, but if you're a sick dude, if you have a problem, or an open wound, so I would say an open wound, or definitely a dog bite. If you get a bite by a dog or a cat, you probably want to go to the doctor or the hospital and get antibiotic coverage, wound care, and have it evaluated. Don't just let it go, okay? Next thing is a little bit more fun. This is something I just read, Newsweek. Go to the video again. This is pretty good. So this is, I don't know, we got to look into this. IRS to allow tax deductions on pets in 2025. I just came across this. We got to research a little bit, but here it is.
Yeah.
Taking care of a pet might feel like a full-time job. Now the IRS is allowing citizens to reap the benefits of said parenthood. Even though pet parenting might feel like a full-time job, you can't claim pets as dependents on taxes, but you might be able to write off pet expenses if you meet certain criteria, helping to keep more of your hard-earned money in the pocket. So it says, what can you write off? You can claim your pet on your taxes, but only in specific situations that generally apply to service animals and business income. Here are different tax deductions that pet may qualify: veterinary bills, medical, food, grooming services.
Grooming
but
services.
Here's the thing, though.
Transportation costs, boarding fees, now, and pet insurance.
These are service animals. So, according to the pet, there are 5 common pet tax deductions you may be eligible for in 2025. Service and emotional support animal tax deduction. Now, guiding the blind person or learning a deaf person, assisting with mobility or ambulation, protecting an epileptic person during a seizure. Yeah. Okay. Next, tax deductions for working animals. Pets that provide a service for your business.
Like police dogs.
Yeah, or guard dogs.
Guard dogs, yeah.
A dog working on your farm to protect livestock. Tax deductions for performance animals. Pets whose performance earn you income. If your pet appears in commercials, advertisement. Moving expenses for pets. The move most closely related to the start of work, your new primary job. Your location must be at least 50 miles. So this is a tax deduction for moving expenses for pets. And then tax deductions for pet charities. Fostering animals, volunteer. So anyway, I just want to throw it out. It looks like you have to have, now, here's one thing. It's interesting because it says service dogs and emotional dogs. They're 2 different things. Yeah. Service dog, you have to have, they're licensed, they're trained.
And honestly, I think most people could consider their dogs emotional healing dogs too.
So,
I do.
Well, I just want to throw
it for Oliver.
Right. So what I would do is, you got to talk to a tax, a tax advisor.
Yeah.
Talk to somebody. It's going to be coming out, and you'll see what the story is. Whether or not it's really
H&R Block. Go ask
them.
Yeah.
So, but I just want to throw it out there. I saw that, and maybe if you fit that criteria, you get it done. I mean, I see on the beach when I lifeguard, there's tons of people bring their service dogs on the beach.
And when dogs get older and things happen to them, like they get cataracts, they get. They get all this stuff, and it's expensive. If your dog has cataracts in both eyes, the amount of money for each eye to get done, it's a lot. Back in the day, I had a little toy poodle, Black.
Yeah.
He was smarter than most humans, but he went blind, and we couldn't afford to fix it.
So it's funny. I was just thinking, so you got a service dog. If you're blind, you get a dog. What happens with a dog who's blind? What do they get?
Well,
that's a service squirrel or something.
My dad, when he was alive, right?
What did he do?
My dad, when he was alive, he would get up and he would open the sliding door for the backyard,
right,
to let the dog out. Right. My dad was blind,
right,
and the dog was deaf.
Oh my God.
So he's trying to tell the dog to come and go outside, and he can't tell if he's outside or not.
No, and the dog can't hear him. That's pretty bad. Yeah, that's a bad one. So one more, Jeremy. This is a little bit more serious now, and this is something that I want to bring up, and then we'll end the show.
Sure thing.
So go to the my iPad again, the video.
Okay.
So this one is Fox News. So this was a vote just recently, one day ago. So 204 House Dems vote against bill to give life-saving treatment to infants who survive abortions. So you could look at.
So infants can survive abortions?
Sometimes it does.
Wow.
Yeah. Sometimes the abortion doesn't. Listen. If you get it's listen. I'm going to premise this. I just want to let's start one thing at a time. So there was the House of Representatives has passed a bill that would. The House of Representatives has passed a bill that would penalize doctors who do not provide life-saving care to infants born alive after an abortion attempt. Okay? Now, you could give the pill, and sometimes it doesn't work that well.
So you go for an abortion, and the baby survives it, but they won't do anything to help that baby live after it's been born.
Right.
That's, I don't know.
So, I'll give you some scenarios. If you try to take the pill, depends on where you are in your pregnancy, but just hold that thought. Yeah. So the bill directed healthcare practitioners to operate with the same degree of professional skill, care, and diligence for a baby born with a heartbeat after an abortion as during a normal birth. Doctors who run afoul of the rule would be fined or given up to 5 years behind bars. The key here is that there were all but one Democrat voted against the bill, which passed 217 to 204. With all Republicans in favor. I think that this is, pretty bad. So
Republicans were in favor or Democrats?
No, not one. Only one Democrat voted against it. They all voted against the bill. Against it. No, the Republicans are for the bill to help the babies if they were born after an abortion.
Yeah, there we go.
So here again, all but one Democrat voted against the bill, which passed 217 to 204, with all Republicans in favor. One Democratic Representative Vincent Gonzalez of Texas voted present. So he didn't even do shit. Yeah. And that's So it goes on here.
Wouldn't this be considered an act of God if the baby survives the abortion?
Well, I don't know about that. Go back to me. I'm going to make a couple points here. First of all, state of New Jersey, I want to make a point. State of New Jersey, this is the law. State of New Jersey. You can have an abortion up to birth. No exceptions.
Yeah.
If you're under 18 and you want to have an abortion, you do not need parental consent.
Right.
The state of New Jersey may pay for it, and we have the second most late-term abortion clinics in the United States next to Washington, D.C. The late-term abortion clinics in New Jersey do not have to register and tell the state of New Jersey how many abortions they perform. So we don't know how many they do. So here's the deal, the way the law is in New Jersey. If you are, say, for instance, a 14-year-old girl, and you are 8 months pregnant, and the fetus is healthy, and you're healthy, but you decide you're not going to have the baby, you can have an abortion.
Right.
Now, I looked at the late-term abortion clinics, and they say why the reason people have it. Basically, if you don't want it, that's it. Now, that baby, 8 months. That's a little human being.
Yeah.
That could survive out of you could take that baby out. Now, the abortion, there in the early times of abortion, they give a pill, and a lot of times the pill don't work. The baby aborts, but it's not dead. But here, you got to take that person in there. And they start giving chemicals to that baby because you got to kill it, and then you have to take it. That's a big, you can't do it in one day. Yeah. It's a brutal thing. I'm not going to get into it, but my point is that you're talking about, that's the state of New Jersey law. And people go, well, it's rare. It happens rare. Well, I don't know how rare it is. If it's so rare, why do you have a law in New Jersey where there's no exception? There's no exception. So and why does the first thing I would do with this new governor we're going to get probably, I want every abortion clinic to report how many abortions they do. What stage? Was it an 8 month, 6 month? What was the baby sick? Was the mother sick? Right. So let me ask you this: how many is too many? So let's just say in New Jersey every year 5 healthy girls with healthy fetuses at 8 months have an abortion. Is that okay?
No.
And we're paying for it and the parents don't know about it. The kid could, say the kids don't even live with the parents. They had no consent. The kid can consent to themselves, even if they're 12 years old.
Well,
and the state of New Jersey may pay for it.
Isn't Donald Trump going to be putting into effect where the parents get their children back? I thought that was one of the things he ran on.
Well, yeah. Here's the thing: you got to understand the state law. State has a lot of power. You can't. Right now the abortion laws are with the states. So if the state of New Jersey is going to say, that would be a 15th Amendment or 14th Amendment. So the children having a consent to do abortion, I don't know where that's going to lie, Jeremy. That's a complicated issue because right now the states have the right to make law. Okay? Yeah. I think really what it is, forget about Trump on this one. The state of New Jersey. I want everybody in the state of New Jersey, is this what you want? We should have a referendum. Do you want to continue on with a 12-year-old without consent? How about this? How about they could have the abortion, but the parents have to be notified? They don't have to maybe say yes or no, but they have to be notified. I don't know. We need a discussion. This could be a whole day. I don't have time to, but I just want to let you make a point, though.
Well, Trump, not Trump.
But the Democrats.
Clinton said about this. Yeah, but there needs to be, there's extenuating circumstances for everything.
All right, but here's the thing. Right now, if the baby is born healthy, on an abortion, a botched abortion, how often this, I don't know. It's the principle of the thing. Why would the Democrats say no to that? Why would you say no to that? This is what's happening. And I have some friends who work in inner city hospitals. The girl comes in, she's never seen a doctor. She drops the baby at 9 months, normal, but she's drugged out. The baby goes to the NICU, which is the intensive care unit. The baby dies in 2 days. And the mother, she walks out. It's a late-term abortion.
She walks out ready to make another.
And she don't give a shit.
Yeah.
And it happens. It's reality, I understand, first trimester abortions. I'm not against abortion. I am against abortion, but I understand the reality of it, and so, maybe the first trimester. But my point is, this is a different thing. This is a different animal. This is late-term abortion. Yeah. And to me, that's where the battlefield is. Anyway, I just wanted to throw that at you.
These are amazing topics.
Yeah, so Jeremy, listen, why don't we just give us how to get a hold of us and everything. We're going to shut down this operation because I got to go.
To make an appointment with Dr. Michael Kachmar, it's 732-269-1133. That's 732-269-1133. If you want more information about Dr. Kachmar and everything we talk about and don't talk about, go to JerseyShoreFootAndLegCenter.com.
All right, that sounds good, Jeremy.
Yeah.
All right, and my office number, you had that there. Don't finish it up yet.
I said it twice.
So let me just say, I appreciate everybody, tuning in.
Sure. And please share and subscribe when we're available.
Right.
So you get notifications on when we go live, like on Facebook, on YouTube, and all of that.
Yeah,
subscribe and like.
Yeah.
And share us. Share us with your friends so they can learn too.
Right. All right, Jeremy. Well, thank you very much. Everyone, take care. Have a nice weekend. We'll see you next week. Thank you very much. Bye-bye.